How's it guys, and welcome back to my channel. Today we're going to be talking about the green whistle. I'm going to be telling you exactly what you need to know to be able to use this, if you're qualified to use it, all things you should be careful about, all the precautions I would recommend, and then at the end I will be telling you a couple of stories or experiences I've had that have impacted the way that I use it. So let's jump straight in. What exactly is this thing? Well, how it works is that you pour the Penthrox, the actual drug, in the back of it. If you read the manual, you pop open the thing and you pour it kind of like circular. You don't really have to, but you can pretty much dump it all in there. And how that works is that there's a one-way valve for air in the back, and then inside, you won't be able to see, but there's like sponge of some sort that sits inside there, and then this little canister sits on top. And the way this works is that the patient will obviously breathe in on the end, and air will travel through here, and air will travel through here, and will go into the patient. You can get them to breathe in gently or softly just so that they can get used to it. If they take a really big breath too quickly, they tend to cough and spatter and be like, that's not nice. But if you kind of get them to smell the flavor, because it's got a cherry sweet smell, you get them to smell a bit, you get them to take a small little breath, and then they kind of get more used to it. Once they're then more used to it, they can start taking smaller breaths, and then they can just breathe normally. You cannot give more than 2 of these to any patient within a window. I think it's a couple of days to even a couple of weeks, because it's quite heavy on your kidneys, and then obviously if someone has kidney problems, I wouldn't give it to them. Or if you needed to give it to someone who has a kidney problem, I would limit it to 1, because the breakdown or the excretion of the drug takes much longer, and so they'll have more buildup of the byproduct of the medication. This little thing at the top here is actually just activated charcoal. What that does is that it absorbs all the drug that's being breathed out of the patient. So they mustn't breathe in and then breathe out into the air. You must breathe in and out through the pen so that all of the drug that they exhale gets absorbed by the charcoal. What happens in the ambulances is that, or I guess in hospitals, depending on how big the room is, sometimes they're breathing out into the air, and so the practitioners who are close to them are breathing this in all day, and it actually gives you quite a headache. And I'm sure it can't be good for your kidneys either. So they breathe in through there, air goes in there, and then when they breathe out, it comes through the charcoal, and then that then deactivates the drug that comes out the top. How long does it last? I think it lasts about 10 to 20 minutes. It kind of dries up, or by the time you can't smell anything, then it's obviously gone. There's a way to increase the strength of the whistle, is that you put your finger at the top. What this does is that normally when they breathe in, air goes in the back and in the top. If you block this, you then are halving, well, I guess you're not getting any ambient air with no drug, you're only getting drug. So you're probably getting about twice as much drug in each breath. So if the patient wants to, they can put their finger on top and then they can breathe. This is supposed to be a self-administered medication. So you tie the loop around their arm, and then they suck, and if they then get dizzy or they fall asleep, they stop breathing, kind of like Penthrox or gas and air, whatever you want to call it. It's a very similar procedure or whatever. The manual says it's not meant for children. Where I work, we give it to children. The way we limit that age point, or how young can you give it, is that the patient needs to be able to understand what you're asking them to do. So if they're so small that they don't understand or they can't do it, then you're not going to use it. And the other patient who you're not going to give it to is the patient who's not fully conscious, because if they're not fully aware of what's happening, this can also affect their blood pressures. It can drop blood pressures, but it's not very common, and it generally doesn't put the patient to like a deep sleep unless they really are sucking on it. I had must have been an 8-year-old kid who broke his femur. He was running on a playground. I gave him ketamine on scene because, well, this is not really going to do the thing. And when we got to hospital, he was awake, he had his traction on, and he didn't really have any pain, but we needed to change the traction off for whatever reason. The doctor wanted to remove the traction, and he said, wait, we're going to try this green whistle. So I was like, I have ketamine right here. And he said, no, he wants to use the Penthrox. So we gave him Penthrox. He had fallen asleep on the Penthrox. Like, we gave it a good amount of time. It takes about a minute or 2 to work. And then this 8-year-old had actually passed out from the Penthrox. And once we started to release the tension on the traction, he started to like groan and fuss and move. And you could clearly see he was in a lot of pain. So it's not a very strong painkiller. It's a mild to moderate painkiller. The other experience I've had is that I had a RTA or an MVA patient who was fully conscious, but he had like moderate pain. And so I was like, well, let me give him Penthrox. And he kept on dropping it. So I held it for him very carefully. I had all my monitors on. I had my ETCO2, my saturation, my ECG, blood pressure, all that on, and I held it in his mouth, and he breathed and he breathed and he breathed. And I actually noticed that his breathing slowed and slowed and slowed, and it actually stopped for a brief moment. And as I saw it stop, I was like, this stuff can seriously stop someone's breathing. So I took it out of his mouth. I gave him a bit of a shake on the shoulder, and he started to breathe again. So it's important to note that if you have too much of this, or if you are administering it to the patient yourself, and which you probably shouldn't be doing, but I had spoken to him and I said, can I hold this for you? And he said yes. So you need to be monitoring your patient's breathing and blood pressure and heart rate, but just to know that a lot of this can really knock you out. Be careful if you're going to administer it yourself. So guys, I hope that covered everything. If there's any other questions you do have on this, I would love to deal with them. And remember to take care and stay safe. And bye for now.